Welcome everyone to the latest installment of the Research into Action webinar series. I'm Nicole Elguero, an analyst on CADCA's evaluation and research team. The purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. In today's webinar, we're honored to have Dr. David Jernigan join us for a presentation on his recent article, Interrupted Time Series Analysis of Bar, Tavern Closing Hours and Violent Crime, published in JAMA Internal Medicine in April 2024. Dr. David Jernigan, PhD, is a professor in the Department of Health Law, Policy, and Management and Assistant Dean for Practice at the Boston University School of Public Health. He has written and worked on alcohol policy for more than 35 years at local, state, national, and global levels. He has written more than 150 peer-reviewed journal articles and contributed chapters to 7 books on alcohol issues, as well as 2 chapters on cannabis policy. He has authored or co-authored pioneering works on alcohol, young people, and health worldwide and in less resourced countries, and on cannabis policy and public health. So I will now turn it over to Dr. Jernigan.
Thank you very much. And thanks to CADCA for giving me the opportunity to speak to you all. I assume that you can see my slides.
Yes.
So the first thing I want to do is just credit the research team. It takes a village to do this kind of study, and we had a small village of collaborators. We have no conflicts to disclose, and funding was provided by pilot research funds from my university. So what am I going to talk about today? I'm going to give you a little background on alcohol and violent crime and the opportunity that we had for this study, and then talk a little bit about the methods we used, our results, and what are the implications for policy. So let's start with the background. And as I'm sure many of you know, alcohol use annually causes about 178,000 deaths. Last estimate of the cost, $249 billion in 2010. It is our favorite drug, and 53% of the population drank in the last 30 days, and 16% binge drank, 7% heavy drinkers. It's the 4th leading actual cause of death. It's a little out of age. It's actually 1 in 8 deaths of people of working age, and contributes to more than 200 different disease and injury conditions in the body. What was happening prior to the pandemic was that we could see that alcohol consumption and related harms were rising. And during the pandemic, it seems to have gotten worse, with a particular focus on violence. And there were a lot of stories in the news about violence increasing during the pandemic. And remarkably, despite my attempting to get journalists' interest, despite my writing the occasional letter to the editor, we couldn't get them to include alcohol in the story. And yet you can see from this graph, homicides, assaults, all up substantially, violent crime up, but no similar increase in robbery, burglary, larceny, or drug offenses. So why did we think alcohol was playing a role in this? Well, we know from other research that the relationship between alcohol and violence is bidirectional. It leads to violence, consumption leads to violence, and victims of violence are more likely to have been drinking alcohol at the time. That is, it makes us more vulnerable to being victims of violence, even though I would never say that the victim was to blame for the violence that they experienced. And if we look at various kinds of violence, intimate partner violence, alcohol use increases both the occurrence and the severity of intimate partner violence. If we look at homicides, every day there are about 67 homicides in the US. 19 of those are assumed to be caused by alcohol. alcohol is the number one drug used by homicide offenders, and 40% of homicide victims also had positive blood alcohol concentration. And of those who had a positive BAC, 2/3 had BAC over that legal driving limit of 0.08. You hear a lot about firearms, and I mean, the first point to make on this slide is that um, the rates of alcohol attributable violence actually exceed the rates of alcohol attributable motor vehicle crashes for both men and women, and yet we hear a lot about drinking and driving. We never hear about alcohol caused violence. And then if we move over to to guns, I'm sorry, you can see that the so many firearm owners also binge drink and also drink heavily, which is binging at least 4 times in the last month, or on average more than once a week. Suicide, also closely related to alcohol use. About 1 in 4 suicides, 1 in 5, something like that, considered attributable to alcohol use. They wouldn't have happened if alcohol hadn't been in the picture. And people with alcohol use disorders have greater odds of trying suicide, dying from suicide, and suicidal ideation. So this just sort of sums all that up. These are what are called alcohol attributable fractions. My colleagues in public health conduct big meta-analyses where they put together the results of multiple studies and use those to come out to these estimates of the percent of each of these categories that research suggests would not have happened without alcohol being in the picture. All right, that's the first key piece of background. The second key piece is the link between how easy it is to get alcohol and violence, and specifically how the close relationship between the number and clustering or density of alcohol outlets in a neighborhood and violent crime. And here, again, we have lots of studies that have found that when you increase the number of outlets in a community, you increase violence and crime, as well as things like sexually transmitted infections, noise, injuries, property damage, underage drinking, and so on. So what is possible to do about all this? One of the things we've talked about the most is simply trying to reduce the numbers of places that are selling or serving alcohol. And that's number one on this infographic. Number two, limiting hours or days of sale, I'll come back to. Number three, increasing monitoring and compliance checks regarding sales to intoxicated persons. It's another important area. How can we get this done at the local level? Well, that depends a lot on how preempted you are by your state regulations. But even the most preempted places can use one of these tracks. Some cities can have licensing authority, other places, the state exclusively is the licensing authority. But even if you don't have licensing authority, this is what we discovered years ago in California, is that cities can use their land use powers through planning and zoning to limit the numbers of outlets, to set conditions on outlets, and then beyond that, they can also use nuisance powers to regulate nuisance activities within their borders. So if an outlet is doing something that could legitimately be considered a nuisance, then cities can take action. Now, most of the sort of natural experiments about alcohol outlets, alcohol availability more generally, are in the direction of what happens when you make alcohol more available. And yet in prevention, what we're much more interested in is the other end of the spectrum. What happens when you make it less available? And there are very few studies that have been able to capture this. I'm going to share just a couple with you here. One was done in Atlanta in the aughts, where there was an intentional 3% reduction in the number of alcohol outlets in the Buckhead neighborhood. And that resulted in twice as great a reduction in exposure to violent crime in that neighborhood compared to two other comparable neighborhoods, Midtown and downtown. Now, Buckhead is a relatively wealthy neighborhood, and this was, as I said, a reduction in the actual number of outlets. Here's what happened in a poorer area. You remember the uprising in Los Angeles in 1991. In the aftermath of that, and much of that happened in South Central in a relatively low income area of Los Angeles. And what we found in the aftermath of that was that the census tracts with had reductions in violent crime that were proportional to how many fewer alcohol outlets they had. So this was another place where we could see that association between the number of outlets and violent crime. But it's often pretty challenging to get rid of an outlet, to set limits on outlets. And yet there is one other intervention that is just amazingly simple, at least in concept, and that is changing the hours of sale. And that's what this study focused on. Now, when CDC looked at this in 2010 through the Community Guide for Preventive Services, they found that any change 2 or more hours in the time period in which alcohol was available would affect alcohol-related harms. But they found no such evaluations in the US, nor in restricting hours of sale. And hours of sale matter because of what's often happening in and around outlets late at night. The longer an outlet is open, the more people can drink in that outlet. And the later at night it gets, the fewer the bystanders there are that could possibly stop that violence. So what you're looking at is a time frame of high vulnerability to alcohol-related violence, particularly the later at night that outlets stay open serving and selling alcohol. The studies we do have, there was one really classic one in the city of Diadema, Brazil, where they shifted from selling alcohol 24 hours a day to requiring the bars to close at 11 p.m. and really remarkable drop in homicides, 9 fewer homicides per month over the 6-year period after the intervention. Similarly, in Copenhagen, during the COVID pandemic, they changed the hours that alcohol is available, and that change was associated with 28% fewer violent crimes per square kilometer across the city. So, some enticing evidence from other countries, but nothing available in the US, and all politics are local, including all alcohol politics are local. We figure it's going to be more difficult for policymakers to believe the research if it happened in another country. So we suddenly had an opportunity, which is Senator Cory McCray from one of the senators representing the city of Baltimore in the Maryland State Legislature had a single neighborhood in his district where there was an atypically high number of violent crime, particularly homicide and assaults. And so in Maryland, the state legislature controls most things about alcohol outlets. There are local liquor boards that enforce, but they are appointed by the governor, and the state legislature has pretty granular, pretty micro level ability to regulate outlets. So, and it's sort of a courtesy in the state legislature if a legislator puts in a bill related to his or her particular district, mostly the rest of the legislature will acquiesce, will go along with them. And there are hundreds of bills like this in the Maryland legislature every year. So Senator McCray introduced a bill. It affected just this one neighborhood. The purpose was to reduce violent crime in that neighborhood. And he proposed to do that by reducing the hours that alcohol could be sold in the most popular license category, which are bars and taverns, from 20 hours a day, which is what it is across the city, 6 a.m. to 2 a.m., to just in that neighborhood, 13 hours a day from 9 a.m. to 10 p.m. So this was suddenly a natural experiment going in the direction that we're interested in terms of prevention. So what we did was I applied for a little money to my school. I just wanted to jump on this as quickly as I could. Senator McCray was already the summer of 2020 claiming dramatic results from this in that neighborhood in terms of crime prevention. And we wanted to shore up those claims by doing this with as sound science as we could. So we wanted to determine whether late night violent crime in the immediate vicinity of those outlets fell relative to similar neighborhoods in Baltimore City after this bill went into effect. So the way we did this, the bill had to find a treatment area. And it was a very interesting treatment area. It was really, bounded by 4 streets. And it's that red square on the slide. It was about a square mile. 9,000 people lived there. It didn't fit any sort of neatly available geographic units. It was larger than a census tract, but it was smaller than a county. So it was this unique size. And we wanted to compare it to areas of similar size. So what we did was we looked at 67 different possible neighborhoods in Baltimore. And we looked at things like their outlet density, their total violent crime rate. We used some pretty standard measures of neighborhood disadvantage so we could capture things like female-headed households, socioeconomic status, per capita income, things like that. And so the unit of analysis we used was something that's unique to Baltimore. It's called a community statistical area. And what we did was we ranked all of the CSAs, the community statistical areas, in terms of how similar they were to our treatment area. And then we picked 2 of those to use in our main analyses. So those 2, Southwest Baltimore and Midway Coldstream. We kept the other 3 in the mix, and I'll talk about how we used them a little later. Among other things, they were handy to use for a variety of sensitivity analyses to make sure that what we were seeing wasn't being caused by some other phenomenon. So this just shows you the kinds of things that we compared them on, and that p-value, was the comparison significant? Was there a significant difference? And the only significant difference was percent Black versus percent white. And you can see in the treatment area, it was 92% Black. In the control areas, it was more like 78% Black. These are still heavily African-American neighborhoods. So we didn't figure that that was going to make a huge difference to our analyses. So then we had bars and taverns, and we had a list of all the ones by census block. And then we had demographics, sociodemographics by a larger collection of census blocks called a census block group. And then we had the policy, which was applied to our treatment area and then to these other similar community statistical areas. So we had census blocks nested inside census block groups, nested inside CSAs. And at that last level that we were really looking at to determine whether we were looking at the treatment or the control area and to do the comparisons. The outcomes we were interested in, the primary outcome was total violent crime, and we took the federal definition of this: homicide, robbery, aggravated assault, forcible rape, and common assault. And these are their categories. I didn't name them. And then some secondary attitudes we wanted to pull out of the total: just homicide as well as common and aggravated assault. Now, there's no indication that these things are alcohol involved, but violence is most likely to be related to alcohol use between the hours of 8 p.m. and 4 a.m. So those are the crimes that we included, just the ones occurring between 8 p.m. and 4 a.m. And then we tested a number of different buffers. And what we found is that 800 feet was about where was the most useful radius to use or buffer to use around the bars and taverns. So that's what we looked at in terms of defining crime in the proximity of a bar or tavern. And I'm using this thing bar tavern throughout this because Baltimore has a weird license category called LBD7, and these are actually licensed for both on sale, that is service in the tavern in the outlet, and off sale, that is for takeaway. So that's why we call them bars / taverns. All right, so that's a quick summary of what we did. And we did an interrupted time series. So we looked at, I think, at least 24 months before, and I think 36 months or 24 months. I can't remember how many months, but a large period of time before and then a large period of time after. What we're looking at was there a change in the trend of violence compared to the overall citywide trend? So here's what we saw. So on this slide, that vertical, the x-axis is the time in months, and the y-axis is the total number of monthly crimes per square mile, the vertical axis. And so what you can see in this slide is the heavy dotted line is when the policy is implemented. And in the city as a whole, you've got this gradually declining rate of violent crime. But in our treatment neighborhood, we suddenly have a bump here. And then a different slope to the line, which means that crime was reducing faster in the treatment area than it was in the control areas. Now, in our main analysis, we found a little tiny bump upwards, like a 2% increase in that first month in violent crime overall. Who knows what caused that, and it wasn't even close to statistically significant. So we essentially interpreted that as a 0% immediate change. But it's more as this took hold over time during the post-treatment period from July 2020 to December 2022, you can see that more rapid decrease in violent crime. So yeah, there's the bump, there's non-significant, and then there's the annualized change. And it was decreasing 23% faster in our treatment area than it was in the rest of the city. That translated to an estimated 67 fewer violent crimes in that neighborhood, or about $18.2 million in tangible costs saved on violent crime in the first year after this bill was passed, was implemented in our treatment neighborhood. And relative to the control areas, the change in the opening hours reduced all violent crime uh, by 23% per year compared to the rest of the city. So, yeah, okay. So this is just drilling into that a little bit more deeply. Again, our primary outcome was all violent crime, and you can see it's that middle one that you want to look at. That's the main adjusted model. That 77 translates to a 23% drop. And then the secondary outlying findings, this was quite remarkable because we did find an immediate drop in homicide density by 51% in the first month after implementation, and an annualized 40% in the year afterwards. No immediate decrease in assault density, but a significant and persistent reduction in assault in the immediate vicinity of bars and taverns in the treatment area. Again, about that 23% annual reduction. And this just shows that graphically, and you can see the immediate 51% drop in homicides, and then the 23% drop in all violent crime and in assault, and a 40% drop in homicide over the year after the bill was implemented. And then this is also probably more detail than you need on assaults. Now, there are some limitations to our study. We looked at this in just one Baltimore neighborhood, which limits the generalizability to other communities. It would be great to do this in far more cities across the US. The problem is we don't have that many cities who are reducing hours for alcohol outlets, but that's something to talk about when I talk about future research that we'd like to do. But another limitation is, we don't know for sure whether the violent crimes were alcohol related, but we're taking that segment of the 24 hours when they are most likely to be alcohol related. So what did we conclude? First, this is the first US study to our knowledge on the impact of actually reducing closing hours by more than 2 hours on violent crime. And this is so important because, again, the studies have generally looked at the impact of increased hours of sale on violent crime. And that's what a lot of our research is based on. Longer hours of sale are associated with greater alcohol-related harms. It's likely that shorter hours of sale are associated with less alcohol-related harm, but this is the first study to actually show that in a real world natural experiment. And we found that the policies reducing hours for sale could substantially reduce crime over time. We also conducted numerous sensitivity analyses. For instance, we didn't find that the violent crime was shifting to earlier in the day or moving to adjacent areas. We checked for those, but violent crime was truly reduced. And because of this, we found that reducing late night hours of sale can just be an incredibly effective tool in addressing problem drinking and related assault and other crimes around these outlets. It's much easier to explain, to talk about, In some areas, it may be simpler to get done than the more complex process of trying to actually shut down an outlet, reduce the number of outlets, and so on. And of course, we think this needs to be replicated in other cities. I've had a research assistant look for changes in city level hours of sale and in all our spare time, but I would love to write a much larger bill to study this in multiple cities. Again, I was excited by the findings in Brazil for years, but that was the first time that we actually got to look at this in a US city, and the results were just what we would expect. Now, there are a couple of things that have happened since. One is we realized there was an error in the write-up. And so we had misreported the outlets that we covered in the treatment area. We reported that we covered 26 bars, taverns, but actually only 13 of those were bars, taverns. Then 11 were liquor stores and 2 were taverns. And since in the treatment areas, we've been comparing to just the crimes in the vicinity of the bars, taverns, and not the regular liquor stores or on sale only taverns. We pulled those out of the analysis, we reran them again, and we had very similar results, except even larger. We ended up with a 24% annual reduction in all violent crime, a 53% immediate drop in late night homicides, and a 39% annual decline, and a 22% annual reduction in assaults. Then we also found out that Senator McRae was not the only one who was doing this kind of tinkering, that after he passed that bill, in the next 2 legislative sessions, which were in our study period, 3 more bills passed that affected hours of sale for those neighborhoods, including some overlap with our control areas. And so the control areas affected were one of our 2 primary control neighborhoods and one of our 2 secondary control neighborhoods, but we still had 3 uncontaminated control areas in our models. So we took out the ones that were potentially contaminated and ran the models again with just the 3 uncontaminated as controls. And very interesting, this time, we actually found an immediate drop in violent crime, 14%, where we hadn't found previously, and a 29% as opposed to a 23% annualized drop. And homicides, 48% drop immediately and a 31% drop annually. We have run so many different analyses, so many sensitivity analyses, and the bottom line is that every way we ran this analysis, the results were significant and they just got stronger. So we conclude from our work that reducing the hours of sale of alcohol appear to have significant effect on violent crime in the areas surrounding the alcohol outlets. That's what I've got. I went through a lot. It was fairly rapid, but now we have a lot of time for questions. So I'm going to pull down the slides. That's my contact information. And at this point, I'm happy to entertain questions.
All right, thank you, Dr. Jernigan. So I will actually start the Q&A session, but please, participants, please continue typing your questions in the Q&A box. It should be on the bottom of your screen. So my first question is, you mentioned that, to your knowledge, this is the first US evaluation of a natural experiment suggesting that alcohol policies that reduce hours of sale could substantially reduce violent crimes. Do you have any plans to continue this research? And if so, what needs to be done in order for you to continue this research?
Yeah, well, so the first thing we need to do is get more places to try this, because the more places that try it, the more there will be opportunities to study the effects. Now, that said, as I said during the formal presentation, I did ask a research assistant to search for us anywhere that we could find cities that had done this. And we have a small collection of those. And when I have the spare time, we will try to write a federal grant. Um, I want to speak to one of the questions that I can see in the chat, because to do this across multiple cities is going to be expensive. We did this study mostly as volunteer labor. I paid one consultant and I paid a couple of research assistants. And so the total budget for this was $20,000, which is in the land of scientific evaluations of alcohol policies, dust. It's very, very inexpensive. But to take this to larger scale, uh, we would write, you know, we would write a federal grant.
Right, my second question, who have you presented your findings to and who else do you want to reach?
Yeah, so we're trying to get this out into the news media. We presented to gatherings like this one. We presented to the Alcohol Action Network run by the American Public Health Association. We'll be at the upcoming Alcohol Policy Conference next week in Northern Virginia. And frankly, we want to reach two key groups here. One is you, the people on this webinar, because you're the ones on the ground who can start making noise and raising policymakers' awareness of this as a potential policy tool. And I will say raising policymakers' awareness of this is not lobbying. That is simply educating policymakers. And it's a lot of it, it's just educating policymakers to the tools that they already have in their hands. So not lobbying, but could lead to some useful change, including reductions in alcohol-related violent crime.
And that kind of relates to my third question. How can coalition members and substance use preventionists in the field best use the findings from your research? Now, this can also include teachers, parents, students, and other leaders.
Yeah, well, the way things change in this country is by people starting to talk about them. And I hope that this study leads to greater conversation, leads people to look at, wait a minute, how late are the outlets open in my neighborhood, in my city? Who's in charge of that? Who makes that decision? And particularly in some of our higher crime neighborhoods, which also happen to be, in many instances, both poor and minoritized neighborhoods and neighborhoods where there is overrepresentation of alcohol outlets. And there's a whole other body of research that connects that to structural racism, to historic redlining, and ways that these communities have been set up to have an overconcentration of alcohol outlets. This is one way to start to address that. And it would be my hope that people grab the study, wave it in front of their policymakers and say, hey, I mean, this is kind of a no-brainer. We're spending all this money and effort and police time and everything to try to reduce violent crime. Why isn't this a key tool in our toolbox? Why aren't more people talking about this?
That's great. So those are all my questions. So now we'll move on to participant questions. I see many in the Q&A box and some in the chat box. So please continue sending in your presentation related questions. We'll get to as many as we can. The first question, did you suggest to the senator the idea of limiting hours of service?
We did not suggest it to the good Senator McCrae, although there was a very active group in Baltimore called BGNC, the Baltimore Good Neighbors Coalition, that tried to get a bunch of changes made to the Baltimore City zoning code to facilitate greater community input into the zoning Baltimore rewrote its zoning code for the first time in 40 years, about 8, 10 years ago. And at that time, there was a whole lot of conversation about the outlets. And there were some cool things written into that new zoning code that affected the outlets. So I think there was a lot of community pressure and action raising awareness about the role of the outlets in the neighborhoods. And this, I am certain, is part of what motivated Senator McCray to start casting about for what could possibly be done.
That's awesome to hear how coalitions played a part in, this change, and then which led to your research to show these results. Um, someone is asking, how is marijuana retail stores creating violence as well as alcohol? I don't know if you have any data on
It's
this.
an interesting question. It's a very different drug.
Mhm.
It's a very different drug. The relationship between marijuana and violence on the victimization side is similar to that of alcohol, in that people who have been using marijuana are more vulnerable, to being victimized by violence because they tend to be less in full possession of their multiplied awareness of the environment around them. Um, but the relationship between cannabis use and violence perpetration, much less clear than the relationship between alcohol consumption and violence perpetration. Alcohol disinhibits people, and it disinhibits people in two ways. First, it disinhibits biologically. There are things that happen in our brains with alcohol that make us much more likely to engage in violent behavior. And then it disinhibits sociologically, in that alcohol is the great alibi. Oh, I was drunk. Oh, I was a blackout. I couldn't be held responsible, etc. And so both of those, there's a lot of research showing the relationship between alcohol and violence perpetration.
Do you have any of this data broken down by age?
No. And we worked from the data that were available through Open Baltimore, and they don't provide age of the victims. So these were simply crimes. There's a question I can see in the chat. What were the kinds of pushback? Did owners complain that their profits are impacted negatively? And in fact, there was a lawsuit over this bill, and the lawsuit failed. The court upheld the state's ability to do this. And I'm not a lawyer. I don't even play one on TV, but there are very legitimate reasons for why cities would try to do something like this. This isn't prohibition. This is a reasonable measure to enhance community safety. Oh, so go ahead. We'll bounce back and forth. I can't
Sure.
see the one in the Q&A. I can see the one in
Q&A.
the chat.
Okay. The Q&A, one question in the Q&A is, were the bills introduced because of the need to reduce COVID infections? Do you feel that curfews and general reduction in travel and leaving your home changed the results?
So we did, in one of the sensitivity analyses, put in a dummy variable for COVID factors, did not measurably change the results. So we tried to account for various changes that happened during the pandemic. And I would say the stimulus for this bill, as far as I remember, was there was one particularly outrageous outlet in Senator McCray's district. And that outlet over and over had homicides on its doorstep. And this was, I'm not going to say the name, but we all knew the name. I was in Baltimore at the time. It was notorious. So sometimes single incidents can be enough to get a policymaker's attention. And that's really the bridge. Somebody wrote, how do we communicate effectively about this? in a positive way. And the positive spin on this, and I don't think it's spin, I think it's true, is we all live in the same communities. The retailers live in the communities. We live in the communities. We all, our children walk the same streets, go to school at the same schools. And so enhancing community safety is a plus for everyone. For the business community in general, a safer community means it's possibility for more and different businesses to thrive. And then communities are not just left looking to the alcohol or the cannabis outlets for economic development. Jim Fell asked, did we monitor the bars and taverns to determine if they really complied with the hours of sale? We did not. But there was a lot of publicity around this, and it appears that there was a relatively high level of compliance. Um, the Baltimore police spent a lot of their time on alcohol-related enforcement. So, but no, that's one of those things that we could not monitor.
And we'll do one more question. Is there any research that suggests that this type of intervention could prevent gender-based or sexual violence specifically?
Well, we were measuring violence in general, but the same fertile ground that leads to the kinds of violence that makes people vulnerable to the kinds of violence that we studied. It's reasonable to hypothesize that those would extend to interpersonal violence and to sexual violence, at least of the sort uh, that occurs in public spaces. I don't know what impact this would have on sexual violence or interpersonal violence happening in the home. That's something for future research to look at. Let me just say, I think we're winding down, but I just want to underscore again. I mean, this relatively simple intervention, for a relatively simple intervention to have this big an effect, it just kind of blew me away as a researcher, as an advocate, as somebody who cares about what's happening in our communities. And I really appreciate people being on the webinar, and I really hope you can take this and run with it. And I have put my contact information into the chat. Get in touch if you need our help in running with this. Hopefully, we don't need 10,000s of these studies. We have one last question. Are you only looking at cities that have hours of operation longer than 10 hours? No, I'm looking for any place that changed the hours of sale more than 2 hours in a preventive direction, because CDC concluded that it had to be more than 2 hours to have an effect. This was a 7-hour change in the hours of sale. So that was a big change. Anyway, thanks very much for the opportunity to talk about this.
Thank you. And thank you all for your questions as well. I'll just wrap up here. So I want to remind you to please take a couple of minutes to complete an evaluation for this webinar. You can scan this QR code with your phone's camera, and I just put the link in the chat as well. You can receive a letter of participation if you complete the evaluation, and you can download it from the thank you page at the end of the survey. Please make sure you download it right away. And I will send a follow-up email to all attendees this week with a link to the presentation, a copy of the article, and as well as the evaluation.
Let me just say one more thing, which is that I also sent, and CADCA will send out, alcohol availability is regulated differently in every state. And on my old website at camy.org, camy.org, we have a map that shows state by state the degree to which localities can or cannot directly regulate the alcohol outlets in their jurisdiction, or whether the state has occupied that whole area of regulation. It's very easy to use, and so we'll send that link out as well.
We do have the next Research into Action scheduled on Tuesday, June 4th at 1 p.m. Eastern Standard Time. It'll feature another research article by Dr. Adrian Bravo. He will discuss his research on depression and anxiety symptom changes and using cannabis as a coping motive in young adults. And registration for that will open in a couple of weeks. And the annual survey of coalitions for 2024 is still open. If you have not completed it, please email survey@cadca.org to receive your coalition's personalized link. And if you complete the survey in May, your coalition will be entered into a drawing for one free registration for our Mid-Year Training Institute in Chicago this July. And that is all. Thank you, Dr. Jernigan, for your presentation. It was truly insightful, and if anyone in our audience has any evaluation or research questions, please reach out to our evaluation and research team. That's evaluation@cadca.org. And as always, thank you for your participation and support, and we'll see you next time.
Thanks. Bye-bye.
Thank you.